HIV/AIDS is not an unfamiliar term, nor is its meaning foreign. Yet the CDC says 1 in 5 people who have it don't know they have it. Where are we in terms of this disease in Northeast Ohio? I went to the Cleveland Department of Public Health to find out, and I discovered it's not the number of cases that surprised me, it's the attitude surrounding the disease. According to the Cleveland Department of Public Health, there were 212 cases reported in 2014. 70% of them were African American, and 50% were gay or bisexual men. Chief epidemiologist Jana Rush says the numbers are encouraging because they have stabilized over the past 5 years due to the department's efforts to reach the community.
We're out in the community a lot more, and we're definitely targeting the younger population more to help break down that stigma associated with HIV.
AIDS has been a part of our culture for over 40 years. Every 9.5 minutes, someone is infected with HIV, and yet the stigma surrounding it is still an issue.
We don't want to talk about it. We want to push it under the rug.
Tammy Jones has worked with the Office of HIV/AIDS Services for 15 years and says what disturbs her the most is the fact that
people are not getting tested. We need individuals to get tested. We need people to know what their status is.
Statistics show the highest incidence of HIV/AIDS is in the African American community, the community that gives Jones the most resistance.
We've received a lot of pushback in the African American churches. We have tried to get in, and we receive false invitations. Many of the problems, especially in the church, is we're promoting fornication or adultery, and that is not the case.
Brian Jones is the face attached to the numbers we see, an African-American gay male who has been HIV positive for 32 years.
There's some social drivers that are in place, or structural disparities that are in place that keep the stigma alive, such as the HIV criminalization laws. When you get a diagnosis, they say, okay, you're HIV positive, and also you need to sign this paper because it's a felony if you don't disclose. Also, you have internal stigma from people who are positive. So that's why it's necessary for more positive people to step up and say, I'm HIV positive, I ain't got no shame in my game.
As an HIV/AIDS advocate, Jones takes his no shame message to the streets, where he passes out condoms and educates people on services that are available to them.
A lot of times you hear people say, well, do we do grassroots? Well, you don't need to do grassroots. I do dirt advocacy, because in order for the grass to grow, you got to cultivate the dirt.